developed some unnecessary movements on the face post Bell's palsy, and you are wondering that your face is not functioning as same as it was functioning before you developed Bell's palsy, then it is quite possible that you have developed something called as synkinesis. In this video, I'm going to talk to you about 5 important steps that you should definitely keep in mind and practice on a daily basis if you have developed synkinesis. So, let's get started. Friends, in synkinesis, you will observe that whenever you try to do a specific movement on the face on the affected side of your Bell's palsy, other muscles will also start getting contracted. That's whenever you try to smile, your eyes will get smaller. Whenever you try to raise your eyebrows, you will observe some mouth movements. Whenever you will close your eyes, you will observe that there is a strong pull around the corner of the mouth. These all are signs and symptoms of a condition called as synkinesis. Well, synkinesis is not a disease. It's a habit that your brain has developed, or you can say you have developed over a period of time when you were recovering from Bell's palsy. This specifically happens because of this following mechanism. When you develop Bell's palsy, your brain is at a survival mechanism. Its job is to bring your movement back as soon as possible and make your facial movements possible. It do not care about what kind of facial movements you are doing. Is it accurate or not? Early in recovery, where your signals are weak or inconsistent, your brain compensates by recruiting extra muscles, increasing the effort on the muscle and using old movement shortcuts. Even your normal side of the face will start getting involved more than expected when you are recovering from Bell's palsy. This definitely helps to return your movement faster, but it comes with a downside. The brain starts building movement together. That's where every smile involves the work of the eye muscle. Now, imagine if every early smile required eye involvement or eye contraction. The brain learned that pattern. Over a time, that pairing became hardwired and automatic. And even when your nerve has healed, this pattern is so hardwired that you continue doing the same pattern of movement without you willing to do it. This is why often unnecessary movements on the face are visible post Bell's palsy recovery, or as this stage is called as chronic stage of Bell's palsy or synkinesis. This unwanted movement often increase but do not decrease over a period of time if right therapy is not taken. So here the question comes, why reinforcing worsen the problem? Here's the science behind it. Strong, repetitive, exaggerated facial movements teaches the brain one thing, and that is, this is the correct movement pattern. If your eye closes every time you move your mouth, then the brain is constantly getting that feedback that this is the right way of doing it. And that's why brain continue to follow those patterns. Imagine every time you smiling with an eye contraction and that same thing happening again and again for over hundreds and 500s of time. The brain assumes that this is how it functions. This is how I need to work, and it locks it in. This is how synkinesis become more established, and the more established the synkinesis is, the more difficult it is to reverse it, at the same time reduce it. Even the more older the synkinesis is, the more longer it's going to take to unlearn those movement patterns and relearn the new movement patterns. Now the question arises, but why? Tightness shows up when you have synkinesis. Now here's the reason for that. When multiple muscles activate together, that too repeatedly, they start behaving like a single unit, a single stiff unit of face that moves together every single time without muscles moving independently and in rhythm. This particular phenomena leads to facial tightness, a sense of pulling or resistance, fatigue with expression, reduced spontaneity in your face. At the same time, sometimes when that continues over a period of time, it can give you facial pain as well. That facial pain can further transfer towards your TM joint, giving you a TM joint pain and even headaches. That's why it's not weakness, it's overactivity of the facial muscles. So, how do one overcome this problem? Well, the real goal of recovery is separation or training isolated movements, not strength. Healthy facial movements are isolated in nature, which means the muscle knows to move in sync with each other but not together as a unit. It's all about selective control, where one intentional movement equals to one muscle group contraction and other muscle group relaxation, which leads to a clean movement pattern that we observe on a day-to-day life. That's why this problem requires a strategic rehabilitation protocol, which we call as facial rehab, which focuses on slowing down the movements, reducing the effort of doing facial movement, isolating one muscle activation at a time, calming the overactive muscles, and retraining brain to uncouple the coupled movements that have been developed. That's why here you are teaching your brain this movement no longer needs the effort that you are right now putting to create an action. So let's move on to the core part of the video, which is the 5 important practices or that you should keep in mind to ensure that synkinesis can be reduced or managed. Number 1 here is slow everything down, way down than what it is right now. What do I mean by that? Let me explain. Unwanted co-activation of facial movements is the reason for synkinesis. For example, as you can see in this image, when a person is trying to smile, along with the smile muscles, the eye muscles, the forehead muscles, the nose muscles, the chin muscle, the jaw muscle, and even the neck muscles are getting contracted, which ideally should not. And this contraction leads to this unwanted, distorted facial expression. So the idea at first place is to reduce the intensity of the contraction itself. So unwanted co-contraction thrives on forced effort. So you need to reduce the force that you are applying on your face. Whenever you will move your face quickly, the brain will recruit the backup system and your muscles will start activating together automatically. So at home, build this habit of moving your face just 25 to 35%, which means slow speed, slow blink, slow partial smile. And if you feel that you are not able to do that, then apply some resistance or force on the unwanted facial movements. Slow movement will give brain time to process and choose only the muscle that needs to be moved. Next, use less effort to move your face than you think. Habitually, when you develop synkinesis, you put more effort to do a facial movement than you actually think you are putting on. This again requires a lot of conscious work, introvert thinking, and acting accordingly. Most people try hard to create movement on the face. This movement feels awkward, and that's the instinct which backfires. That's why at home, do this practice. With minimal effort, try to move your face. Don't aim at achieving maximum range. Don't aim at achieving complete smile. Don't aim at achieving complete eye closure. That is a secondary goal now. The first goal should be achieving a free movement with minimal effort. A small, relaxed movement done cleanly and clearly is far more valuable and effective than forceful contractions on the face. Remember this, efforts will feed synkinesis versus calmness will reduce your synkinesis. That takes me to the third point. Stop before fatigue, not after. Many a times when you are constantly working in front of screens or on the days when you speak a lot, your muscle gets fatigued very easily, making your synkinesis furthermore worse. That's why it is highly important to listen to your body and take a pause whenever needed while using your face to allow your facial muscles to calm down before even they reach to that stage of fatigue. That's why at home, do this practice. The moment you feel facial tightness, heaviness, or loss of control, apply warm compress. Rest your face. Do some gentle massage on the facial muscles, especially over the area where you feel heaviness, stiffness, and spasm. And resume back with short, frequent, low effort practice of doing facial movement. This way you will beat the long sessions that are effortful, forceful, and fatiguesome. Because remember, a tired face will always try to use shortcuts, which we don't want here. A rested face will be able to focus well and perform those integrate facial expressions that we want to bring back. That takes me to point number 4. Practice one intentional movement at a time. I see a lot of people forcing facial muscles and trying multiple movements at a time. This confuses your brain further. The better strategy is to focus on one expression or one movement at a time and master that movement, allowing other muscles to go out of the picture and focus on only one particular expression. This expression could be of surprise, could be of blink, could be of smile, could be of pucker, or even could be of sad expression. That totally depends on which of the expressions are more important for you and are more difficult for you. You have to keep this one principle in mind, that your face should move more selectively and the synkinesis should blur as much as possible. Hence, while practicing at home, ask this question to yourself. What is that one facial expression that I want to work on right now? Practice that expression. And if something else moves, reduce the force of the movement, calm that muscle for some time and start your practice again. Here, you are training your brain. Here, you are training your brain to work in an uncoupled action manner, which will not force the facial muscles to contract at the same time. And that takes me to point number 5, which is spend time on relaxing your facial muscles on purpose. If you who are observing this one sign, that with each blink there is mouth movements happening, then please understand this, that you are constantly forcing your eyes to contract. Your blink speed is too high and you are in a very unrestful state. That's why you need rest, especially your facial muscle needs rest. So give pause as much as you can. The pause could be as short as 2 minutes to as long as half an hour. That's totally up to you. Several times in a day, give this 5-minute break to yourself, or depends, the timing is something that I leave completely up to you, how much ever time you can give to your face. Let your face rest completely. Loosen your jaw. Bring your lips gently together. Make sure that your teeth are not clenching with each other. In fact, there is a very small gap between two teeth, especially the end teeth of your mouth. Make sure that your eyes are soft. Breathe gently and gently allow your facial muscles to calm down in a slow and steady manner. You can even count backwards to allow this calming down to happen. Notice and release that unconscious holding that's present on your face. A calm baseline will reduce over a period of time, and you would be able to slowly and gently bring back the control that is lost on the face when you will do this practice for a sustained period of time, but in a mindful way. But also remember this, these tips will not fix your problem completely. They will reduce the tension and spasm and that unnecessary movements that are immediately coming up on the face. Then you need to take a route of a facial rehabilitation where in a step-by-step manner, strategically, you are allowing your facial muscles to retrain the facial movements the way they were being working before you developed Bell's palsy. For this, we have created different types of programs and formats with which we can help you to overcome that. So, if you want help in your synkinesis recovery and management, feel free to reach out to us so that we can help you better. On that note, I'll end this video here and I'll see you in another video. Thank you.